A bunion is actually a bump that you have on the base of your big toe. And it's interesting because it's actually not an increased amount of bone or anything like that. It's actually a change in the position of the foot or the shape of the foot. If you look at this slide, you can see here you actually have a fairly large bump right here at the base of the big toe. And again, that's not a matter of a problem of more bone, as you can see from the x-ray. This is actually the fact that the bone is actually leaning away from the others. Bunions actually develop from a couple of different ways, but you actually get to thank your mom most of the time. So usually it's a hereditary thing and mom or dad have it. Other possibilities are you could wear too tight of shoes, and unfortunately some people just get them, we don't know why. Minimally invasive bunion surgery is a very new technique. It actually was developed in Europe about 25 years ago. And during my fellowship training, we did well over 100 of these type of procedures. It's something that's very cutting edge, very innovative and revolutionary to treating bunions. The advantages of a bunion surgery that's done minimally invasive type of bunion surgery is that you have very small incisions. As you can see here, this is a traditional bunion surgery where you actually make a very large incision and actually have to cut the bone and open up the joint. After the surgery, you can actually see where they have stitched the skin together. With this, you see the minimally invasive bunion surgery, you see these very small poke holes that are only about 2 or 3 millimeters in size. We actually use an x-ray and a very small device that's called a burr, and we cut the bone and move the bone to the corrected position, and then we stabilize it with screws. These screws are about 4 millimeters in width, and they're actually what's holding the bunion correction. The advantage of doing it this way is that because you don't have to go into the joint and in order to actually get the correction, you have much less stiffness afterwards, you have great motion, and the recovery is much faster. If you're having a painful bunion, you come to see me in the clinic, and one of the first things we'll do is do a good history and physical. And then we'll also do a x-ray to actually see what the bunion looks like. At that point in time, we'll discuss options. Some of them might be non-surgical. We'll try to do things like making sure that you have the correct shoes. We'll try to make sure that there's good padding around where the bunion is, and those sorts of things. But if those are not helpful and you're still having pain, then we do have a surgery to perform, and that's this minimally invasive bunion surgery. That would be done as an outpatient. It's usually done under sedation, almost like having a dental procedure, and then we give you some numbing medicine around the foot. We do the procedure, it takes about 45 minutes, and then you go home and you just have a soft wrap around the foot, and you have a hard shoe to wear. You wear that for usually the first 4 to 6 weeks or so. You come to see us at about a week, we change the wrap. You come and see us at 3 weeks, we actually get you out of that wrap and just into a few Band-Aids. And then at that point in time, we let you start doing a little bit more activity. A lot of times we'll start physical therapy at around 3 weeks or so. And then again, by the time 6 weeks comes, you hopefully are back to regular shoes and maybe even back to exercise. The biggest complications from this procedure actually are because we're making small incisions, that there are small skin nerves that you can have a little numbness from. And that's usually because they're stretched or pushed and they don't really like that very much. So you get a little bit of numbness in the area. It usually gets better. However, the risk of this is actually much smaller than the open procedure, because in the open procedure, you're making big incisions and you're really having to move the nerve around a lot. So the likelihood of complications is less with this procedure. I'm Dr. Jeffrey Levy, an orthopedic surgeon specializing in foot and ankle surgery with Riverside Orthopedic and Sports Medicine Specialists.